our schedule is 10:30 to 12. So I think everyone is okay man, no? Everyone is awake, alive pa, no? Dili pa sleepy, dili man ting nap time, dili man ano, dili man siesta time. Okay, ra gihapon na. Mas maayo guys, no, maligo jud sa buntag, no? Para ma-alive, alert, awake ka, no? Di lang ta magsaba kung kinsay wala pa naligo karong adlaw. But mas maayo jud ang maligo ta in the morning para fresh na fresh ba, no? Di ba ta mo atog school nga wa tay ligo? Well, depende na ninyo, no? So, mas maayo nga so that you're awake ba, it makes a whole lot of difference. I tried that before nga. Later na ako maligo at night kay para lami akong tulog. But it's different when you take a bath in the morning because it seems like you're ready for you're ready for whatever the world will bring to you today, no? So this is one. Okay, so moving forward, why ethics? Why do we need to study ethics, no? All professional roles will encounter manggod ethical problems. That is why we need to study ethics. Because when we are faced with ethical problems, there are proper ways for us to address these problems. Whatever profession you are in, may it be in the medical profession, even in the corporate world, there are ethical problems that will arise and that we will have to deal with, no? So we study ethics so that we will know how to deal with these ethical problems. Ethics is about reflecting, thinking, critically reasoning, justifying, acting on, and evaluating decisions. So you reflect if it is right or wrong. You think, you critically judge, or you critically reason, justify and act on and evaluate decisions that we make, no? It is the knowledge and understanding of ethical reasoning and ethical decision making are essential for competent occupational therapy practice. For you to be able to say that you are a competent occupational therapist, you need to have the knowledge and understanding of ethical reasoning and ethical decision making. Sometimes we think, ethics again, ethics running a course, ethics running a subject, but it's very important. As part of our growth as professional and competent occupational therapists. It's very important, no? We may take it lightly, but later on I will show you samples of ethical problems that we will be facing in the future. Okay, so first let's try to define the terms that we use. Sometimes, no, ethics and morality, it's sort of interchangeable. No, it's ethics, it's morality, it's what's right and it's what's wrong. So it's a set of rules that we need to follow. Well, let's try to define each of it. So ethics is a branch of philosophy. Excuse me. Ethics is a branch of philosophy that involves systemic study and reflection, providing language, methods, and guidelines to study and reflect on morality. Sorry. So it is, again, the systemic study and reflection, providing language. It is the one that provides language to our organization. For example, in PAOT, in the occupational therapy world, it provides us the methods and guidelines to study and reflect on morality. Morality, on the other hand, refers to social conventions about right and wrong human conduct and sets the stage for ethical behavior. Therefore, the ethics that we have in occupational therapy is based on morality. So morality is a bigger umbrella than the ethics, no? Claro ra? Claro? Okay. Moral reasoning, on the other hand, is the process of reflecting on ethical issues. What about the norms and values, ideas of right and wrong, and how practitioners make decisions in professional work. So the reflection process, how we justify, how we reflect on it, how we critically analyze and make the decisions, that is moral reasoning. Claro so far? Yes. Values, on the other hand, are the beliefs or objects a person holds dear, no? This is different from person to person. What I value may be different to what you value, no? Our values are different. Most of the time, it is based on how our parents raised us, no? In our culture, or in my family, kani, we're very conservative. Ingon ani. So those are your different values, no? It differs from person to person. Also, it can be cultural as well. In our culture, for example, it's very important that we take care of our parents, that we take care of our grandparents. But in another culture, that's not practice, that's not what they believe in. Yes, they take care of their parents, but in a different way. They put them in hospice centers, they put them in home for the aged. So it's a different practice. But see, so there are different values from person to person. Duty describes an action that is required. So for example, what is my duty? My duty is to teach you because I am your teacher, no? My duty is to cook food because I am a wife, no? Mapalami na or dili, dapat kaunon jud na sa akong bana ang among pagkaon. Charot, no? Pero dili mag-judge kay lami ang gipangluto ni Miss Gab nga mga food. Mayra mo luto si Miss Gab kay naay air fryer. Charot. Dili bitaw tungod sa air fryer. Lami jud ko muluto mapanaa or walay air fryer. Okay? For sure na may uban diha ganahan sad kay air fryer. Kay mo man ay usa sa requirement sa pandemic mag air fryer. Pero actually guys, it's very healthy, it's very nice. Wala pa mo chika gamay nagcook ko this morning because I didn't have time to cook because I had a lot of patients plus I have class back to back. Nagcook ra ko og hash brown. But the healthy way, charot. No oil. Gi-air fry lang ang hash brown, di ba? In 15 minutes, wala ko gibuhat, naluto na ang hash brown. Di ba? Pero healthy ra, charot. Okay, moving forward. Moral character describes traits or dispositions that facilitate trust and human flourishing, no? For example, your moral character, our moral character as occupational therapists, we need to be compassionate, we need to be caring, we need to be honest, no? So that is your moral characteristic. Now, what are the three types of morality? You have personal or individual, group or organizational, and societal. Personal morality are your individual beliefs and values. That is your own, no? For you, what is right or wrong? What your personal thoughts or vision or personal perspective on what right or wrong is. Group or organizational is the morality of the profession or organization to which an individual belongs. So for example, in the OT world, for PAOT, for AYOTA, we have our set of code of ethics. We have a set of OT standards of practice. We have a set of core values and attitudes that are expected of occupational therapists. So that is the group or organizational morality. Societal morality is the morality of the society as a whole. What are the norms? Whatever culture you may be, what is the morality of the entire world? No? What is the common morality? The societal norms, what is it? So that is your societal morality. Now, what are the virtues of healthcare? Wait lang, I'm sorry, I forgot to also instruct Cha. Since you have a list of your classmates, for now, wala lang sa tay icebreaker, but I want you to assign for every class of 206, we meet only once a week, right? Because we have SDL and what do you call this? SDL day. For every lecture meeting, please assign one person to give an icebreaker. So at the middle of the class, mag-icebreaker ta. No? It can be anything, video that you want everyone to watch, a game, quick game or stretching, imo bang ipa-jumping jacks imong classmates. But of course, make it fun naman, no? So assign lang please chat one person per day. Okay, moving forward. Virtues of healthcare professional. What are the virtues that are expected of healthcare professionals? Virtues of integrity, benevolence, competence, kindness, trustworthiness, fairness, conscientiousness, caring, and compassion. No? So these are the virtues that are expected of us. OTs must be benevolent and focus on what is best for the client. No? We must always do everything for the benefit of our client. Not for us, but for our client, no? We must always put them first, not ourselves. Sometimes, no, that's the downside of when you get burned out with your work. I had experienced that before when I did not put my client first and I placed myself first. Do not follow that, no? Dili na siya maayo, no? But that happened to me before because I felt so burnt out ba with my work. Diba, I was working for a pediatric clinic before. So imagine I was working Monday to Saturday, 8 a.m. to 6 p.m. That is almost 9 to 10 kids a day. There are 2 hours pa nga mag-group ko and I have 4 kids in a group. So imagine my kakapoy, my, you know, and it's the same thing every day, Monday to Saturday, good, no? Murag kinsa akong gibuhi, mura ko gabuhi og pamilya, single pa baya ko ato. Pero ako kay bao nga nung abiba kay kumutrabaho ato nga time, no? So I work from Monday to Saturday, the same thing every day. And I just felt burnt out after a couple of months because everything was so routinary. And then I remember that I had a kid. He was big, manggod. He was, I think, around 14 years old. And then one of my activities for him, most of the time, when we meet each other, we meet MWF. Most of my activities for him are, before we actually start the activities, I always let him exercise because he's very tapulan, he's very, you know, he's big lagi, he's a big guy. Yeah. So I have to, and we have a mini gym in that clinic that I worked in. We have a mini gym. Well, actually, we have a mini gym for kids and we have a gym for like adults. We had treadmill, we had the bench press and all those things, no? So I would let him exercise for around 15 to 20 minutes before we, actually 15 minutes before we start the activity. So of course, lain sad kayo mag-exercise siya. Si Miss Gab gatan aura, di ba? Whatever my client does, I also do so that he will follow. O, di ba? So si Miss Gab mag-exercise sad. 15 minutes every MWF. Imagine na mag-jumping jacks ko kada MWF. Kapoy kaayo, no? So, there was a time when I was so tired, I did not let him exercise. We went directly to the activity. And true enough, he was very restless. He didn't like doing the activity because I didn't let him exercise before class. So, wala, because I placed myself first before my client's needs, no? Kay gitapo lang si Miss Gab, dili pwede, no? So, do not follow that example, no? Ihatag lang yung example, pwede ito siya i-follow, guys, ha? Benevolence, always for the benefit of your client. OTs must be competent. We are responsible for achieving and maintaining competence in their area of practice, must use evidence to guide practice decisions, and engage in continuing education. I think that's one of the things that really humbled me when I was an intern. I saw my CI, my CI, my CS. We were supposed to go to our client na. It was an inpatient. It was in Manila. It was an inpatient client. And then I was like, I was so ready to go na. I was so ready to go to the client. And then my CS that time, my CS buddy, he was reading Pedretti pa. They had all the books, man. O, sige, Aaron, humana. Okay na, dili na dry ang lips. Plump na. Na-stress ko ni mo, di lagi ni sa amin ang atong camera. Ha? Dili ni sa amin lang ga. Unsa man, mang lip gloss sad ko, ganahan ka? Kapi ni mo eh. Di lagi ni siya sa amin. Wala man gud ni siya pag-orientation. Mauna diha. Nag-orient ko nga dili ni sa amin, guys. Nga di ka mag-makeup sa imuhang kuan camera diha. Kalabad aning bataan ni. Plump na, dili na uga ang lips, Zay. Moisturized na. Kapoy na pa siya pinapout-pout pa. Ayupak ha. Okay, nawa na noon ko. Na-bother dyan ko. Feel kay niya ang moment ipout iyang lips. Ay, ginoo ko may pag napicturan to ninyo. Okay, asan ako ato? Gikapoy ko rin mga okay. I was very humbled by my CS. Because again, I was so ready to go to the patient already. And then my CS was reading Pedretti. Hello, Pedretti. In my mind ba, mani nag-read man ni siya Pedretti? Pang students man ni ang Pedretti. Charot, pang students. And it was that time na I was really humbled by him. Bangamurag, He's been practicing OT for like what, 3, 5 years, and he still reads Pedretti. He still updates himself with the current trends. So it's very kanang humbling lang. It doesn't mean that you've graduated and you have your license. You know everything, no? It's very important to keep yourself updated. It's very important to educate yourself continually, no? So that's one of the practice that Miss Bia and I have been doing with with all of our lectures. Every start of the semester, we don't use the same PowerPoint every time, no? We add some to it, we change some of it, we check what is updated in this, what are the current trends that we can add to our PowerPoints. We study, no, as much as possible. Every semester, actually, we change our questions so that it's not the same every semester, to continually educate ourselves as well. No, we look for seminars that we can attend for free or not. We current we continually educate ourselves, because that is part of what is expected of us. No, as occupational therapists, we must be competent. No. Next is OTs must be caring. Care enhances comfort and recovery and is an essential feature of professional practice. Your clients will know if you care for them, if you're doing your job because you care for them, or if you're doing your job just to get paid. They will know that. They will know if it is from the heart or not. I think one of the best experiences I had was when I was an intern. Kana, I think my first hospital, my first rotation was in a hospital, veterans. And my first patient was a 92-year-old. I will never forget him. He was a 92-year-old veteran, soldier. He was a soldier. He was a veteran. It was his first heart attack, and he couldn't speak. He couldn't move his right side. And mo lagi na intern ba ya? So abiba kay ka, pabibo pa kaayo, because you know I'm an intern. It's my first time, so you're very excited and all. So he was my first patient, and I was really, I gave my all. I really gave my all for that rotation because it was my first time. It was my first rotation. I was very excited, and I was really, dedicated to what I was doing. I even made him I made him like a whiteboard, then I magnet so that he can just, pick what he's trying to say, because he couldn't talk also. So if he wanted something and all, and I really showed, and parents, 92 years old, the children of my client, were really saw how I cared for their tatay. I even called him tatay already also. They really saw how I cared for tatay. And he would look for me good instead of them, kuno. He would try to speak and he would try to speak my name instead of their names. So he would look for me, kuno, and then when I go out, I always encourage him to raise his hand so that he can say bye and all. So the people, not just your client, but even the people around them, their caregivers, their significant others, will really feel, no, if they will see if you're doing it because you just have to do it, or you're doing it because you care for them, which is connected to the next one. If you have compassion for them, no, if you are able to be kind to them, to understand and genuinely show how much you are empathetic and caring and considerate towards them, they will definitely know. When I moved to another setting, because I was there for 2 months lang, when I moved out, they gave me a parting gift, of course, no? Dili man ta mo dawat og cash gift. They gave me a mug, actually. I left it in Manila lang, but still there, they gave me a mug. And then when he passed away, they messaged me. They constantly message me, even if I post something, she comments, the daughter would comment sometimes nga, "Miss, I always remember you. I always remember how you cared for tatay, how you kuan." And when he passed away, they invited me. They wanted me to go to. I actually went. I went to the burial, to the wake. So they would you would be able to establish a relationship with your client. You will know how much they care, how you will they will see how much you care for the client. So that's a very important virtue that we have as occupational therapists. Dili ta mag and I would see mga good others who are doing it just because dako og sweldo, just because just because it's part of their job, and it shouldn't be that way. It being an occupational therapist should always be your passion, should always be something out that should come from the heart ba. Dili siya dapat pinugos, di siya dapat kontra gusto. It should always come from the heart. Charet. But that is true, no? So ethics and practice. Let's try to differentiate what are the problems that arises. We have moral distress and ethical problems. We are often faced with issues and events that challenge our values and beliefs, no? So decisions about what is the right or wrong course of action are based on our profession's code of ethics. We actually have a set or a list of code of ethics, but I will not be discussing that today. I think next week, Miss Penny or Miss Bia will be discussing the code of ethics some other time. But for now, let's try to discuss and differentiate moral distress from ethical problems that we usually encounter. Moral distress is when a therapist knows the correct action, but an existing barrier prevents the therapist from doing so. So for example, you work in a day treatment program. Usually in the mental health setting, you have acute, chronic, you have in-house, and you have a day treatment. A day treatment is for mental health clients that does not need hospitalization or rehabilitation in-house. They just come in maybe twice a week for the program that you have. So that's your day treatment program. So for example, you have a day treatment program and the policy states that you are not allowed to accept people or clients who have history with substance abuse. But there is this one client who would want to join, but you cannot accept because based on the policy, I cannot accept clients with history of substance abuse. But you know very well that the program that you have in this day treatment program will benefit that client. So you know what to do, no? You know the correct action. Kay kuan man siya kanang bagay man niya ang program, but there is just a barrier, which is the policy that was made by the hospital maybe or the department, that you are not allowed to accept clients who have history with substance abuse. So that is a moral distress. Now you know the right thing to do, but it's just that there is an obstacle or a barrier that is stopping you from doing the right thing. Klaro ra ang moral distress? Yes, okay. Now, what is the ethical dilemma? Ethical dilemma is when there are two or more potentially morally correct ways to solve a problem. However, these solutions are exclusive. Dili pwede nga emerge nimo ang duha ka solution. Exclusive jud siya. If you follow this one, dili na pwede ang usa. Or if you follow this one, totally dili pwede ang usa. So for example, there is a school that is looking for OTs, no? OTs who will provide services to their school. For example, me, Miss Bia, and Sir Anki, we have a company of private OTs. And then this school is again hiring for OTs. But none of the three of us have experience in pediatrics. So there are two options. One option is we apply for it, but then mangita lang me, if madawat me, we'll just hire another team member who has experience in pediatrics. That's one. Or the other option is we will not apply at all because we do not have experience in pediatrics. Actually, both of it is, if you look at it, both of it are morally correct naman. It's okay that we apply. If we do not get accepted, then wala. But if we get accepted, we'll just hire someone who has experience with pedia. Or we can choose to not apply at all. Both options are morally correct. So when you are presented with an ethical dilemma, there mo nang gitawag siya og ethical dilemma because you have two or more morally correct options. Claro? Claro? Okay. Questions so far? None. Okay. So how do we now go to ethical decision making? How do we make decisions ethically? First, we identify the ethical issue and potential dilemmas. What are the dilemmas here? Is there a moral distress? Is there an ethical dilemma here? Then you gather relevant information. You determine conflicting values and areas of agreement. Identify as many relevant alternative courses of action as possible, because it's like that, no? When you are presented with an ethical problem, there will always be a lot of options, a lot of possible morally correct option. Muraragod nagmag multiple choice mo and then choose the best answer. Tanan answer kay correct, pero mangita lang ka og best answer. So ingon ana ang ethical dilemma. You have a lot of possible options, morally correct options, but you just have to choose the best. So determine all possible positive and negative outcomes for each possible action. So you have to weigh the pros and cons, weigh with care the consequences of each outcome, seek input from others, and apply best professional judgment to choose the action to recommend. The last two steps are actually Western based. This is based in the Western setting. They also call the SRB. The SRB is the State Regulatory Board. That is the one who helps them. Aside from AYOTA, the State Regulatory Board is the one that helps them with ingon ani, with malpractice, with the ethical decision making. So they call the SRB, and if there are questions about potential ethical violations that could cause harm or have the potential to cause harm, and they determine the desired and or potential outcome of filing an ethical complaint. Like I said, I don't know, I didn't say this, but actually in the Western setting, they're very, here in the Philippines, not so. Yes, of course, we do our best to practice, no, appropriately, nga dili ta magka malpractice issues, but mas strict in the Western setting. They're very particular of the license of malpractice. Kay gamay lang nimong sayop, no? They can sue you for that. They can, and your license can be taken away from you, diba? That's what happens with nurses and doctors abroad. Gamay lang nga sayop, pangitaan kag sayop, they can already sue you for whatever it is, no? So you have to be very careful. Okay, so what are now the ethical, okay pa so far? I think I'm midway the lecture. I'll go straight na lang ha, because it's 11:35 na para ma-finish ta by 12. Okay, so theories provide support for clinical decision making. Ethical theories and principles provide us with a language for diagnosing, communicating, and problem-solving ethical questions in clinical practice. These theories and principles provide like a foundation to how we diagnose, how we communicate, how we make decisions, and how we problem solve ethical questions in our practice. There are 4 theories and principles that we base our ethical practice on. We have principle-based approach, we have virtue and character-based ethics, we have utilitarianism, and deontology. So let's discuss principle-based approach first. Principle-based approach relies on ordinary shared moral beliefs as theoretical content. Principles are duties, rights, or other moral guidelines that provide a logical approach to analyzing ethical issues for a given situation. When you say principle-based approach, yes, it is based on theoretical content, but it's also the shared moral belief. So for example, us in the Philippines, we have PAOT, right? The Organization for OTs. They are the ones who provide the core values, the code of ethics, the core attitudes, the standards of practice, how we are supposed to practice ethically as occupational therapists. So that is what you call the principle-based approach. So what are the different principles under the principle-based approach? You have autonomy. Autonomy is the ability to act independently on one's own decision. It is often regarded as the most important element in healthcare decision-making. Why is autonomy very important? Because you have to be responsible for the actions that you make. When you make decisions, Dili man ni siya nga murag duwa-duwa nga when something happens, imong ipasa sa laing tao ang sa nimo. Autonomy teaches you to be responsible and accountable for the decisions that you make. So autonomy makes you is your ability to make decisions independently, because at the end of the day, you are the one responsible for what you decided to do, no? So for example, no, mag-ask kag advice sa imong friend. Pwede man ka mag-ask og advice sa imong friend. Unya kanang sige moduko ani mo ni ang akong buhaton kay ni ana akong friend nga mo ni akong buhaton. But at the end of the day, when you make that decision, di man na nimo i-blame sa imong friend. Ni ana manggod ka nga mo ni akong buhaton, dili, no? Because you are responsible for the decision that you make. Ni-advise naman siya, pero ikaw ang ni-choose to do it, no? Kasabot. So autonomy is teaching you also to be responsible and be accountable for the decisions that you make. So that is autonomy, independently, ability to act independently on one's own decision. Beneficence refers to actions done or for the benefit of others, no? Beneficence is for the benefit of others. Whatever you do as occupational therapist, whatever you decide on, it should always benefit your clients. Non-maleficence is the duty to not harm your clients, no? It is your duty to protect your clients. Kasabot, whatever you do, dili pwede nga ma-harm imong clients. I had a friend, she experienced, she had a complaint from one of the parents because she was seen, she was holding a pencil, the pointy part, murag iyang giana-ana while talking to the kid ba? Iyang giana-ana lang while talking to the kid. And nakitaan sa parents. And lain kaayo tan-awon. So feeling din sa parents nga, i-harm iyang anak because giana-anaan og pencil. The pointy part was pointing to the kid. So kana, non-maleficence issue to siya. Pero actually, it was very, innocent for my friend ba? Nga, wala lang, she was just doing that using the, murag how you talk, diba? Sometimes iwara-wara nimo ang imuhang ballpen, ang imuhang kutsara o tinidor when you're talking and eating, no? It was just like that good, but na-issue siya ato og non-maleficence. Pero wala ra siya gi-filean og complaint man, no? Okay, next, what are other principles? Under principle-based approach, fidelity. It means being faithful to both implicit and explicit promises or commitments. Guys, like I don't know if I told you before, do not make promises that you cannot keep. May it be in your professional life or in your personal life. No? Do not make promises that you cannot keep. No? Always make sure that you are able to keep your promises. I am telling you, especially your mental health clients, they know so well. You ask, when you go to them and they say, usually they tell me, man, yes, mangayo po food or water or whatever. And then you tell them, next week na, next week. Next week, balikan ka, pangayuan jud kami, sa anak ka mo hatag kag food. You have to be careful with the promises that you make. You don't tell them, oh, makagawas ra ka in 2 months. Guys, in 2 months, singlan jud ka anak niya, anak ka makagawas ko. Do not make promises that you cannot keep. Do not commit to something. Do not commit to something that you cannot keep, ha? Dili mag-commit if dili kaya. Dili magsanong-sanong if dili kaya. No? One experience that I had, chika si Miss Gab, no? In my personal life, one of the, my goodness, vows pa, ha? One of the vows I made during our wedding, I said pa to my husband, I vow, di lagi ni siya sa amin, Aaron. Ay, manudlay pa, Jude. I said to my husband during our wedding, I vow to scratch your back every day. Because my husband likes na magpa-scratch Jude sa iyang back. I don't know, feel niya nga, bugnaw iyahang feeling if magpa-scratch siya sa iyang back. So So I said in the wedding, in my vows, I vow to scratch your back. True enough, every time nga magpa-scratch siya sa iyang back and I do not scratch his back, mayon ko, ay kapoy, iyang ilabay na ko og balik. But you said when we got married that you vow to scratch my back every day. Goodness gracious. Wa ko'y takas, guys. Kay wedding good to na mo. Naagoy daghang witness nga ni vow ko ana. So every time I do not scratch his back, ni anak kapag kasal nga imo kong i-scratch. I even bought him a scratcher para maningkamot na siya giya. Di gihapon siya kay lahi jud kuno ang akong kuko. Halawa ko kay baw nga noon say naa sa akong kuko. Mauna siya ang akong kalbaryo sa akong pag-promise nga kailangan i-keep. Mauna guys, may it be in your professional work or in your personal life. Do not make promises. Shh! Kadungog lang siya nga, siya'y akong topic. Kanang, do not make promises that you cannot keep, no? For sure, iyan na sad ning ibalik na ko, imo manggani giingnan imong students nga mo scratch ka sa akong back. Iyan na sad nang ibalik na ko ron for sure. Okay, next is justice. Justice refers to equal treatment. It deals with the proper distribution of benefits, burdens, and resources. Procedural justice is often used to reflect impartial decision-making procedures. Distributive justice refers to the equitable allocation of societal resources such as healthcare. This will be discussed further under your Code of Ethics, OT Code of Ethics, next week. Veracity refers to telling the truth, being honest. Paternalism or parentalism, this is actually an old principle where the individual assumes to know best and makes decision for the client. Because I'm the therapist, I know better than you. This is actually an old practice, which is not practiced anymore now because it contradicts the autonomy. So wala na ni siya ang paternalism. Now, what is virtue and character-based ethics? These are dispositions of character and conduct that motivate and enable clinicians to provide good care. Virtue ethics is derived from Aristotle and Thomas Aquinas. It focuses on moral agents and their good character. Using this approach, moral goodness is achieved when behaviors are chosen for the sake of virtue rather than obligation. So you are doing your job or you make decisions or you face ethical problems basing on your virtue and your own character, not basing on the principles set by the organization, but basing on your own virtue and your own character and moral obligations. Utilitarianism is derived from the work of Jeremy Bentham and John Stuart Mill, is concerned with actions that maximizes good consequence and minimizes bad consequence. This is the morally right. They believe that morally right acts produce the best overall results. That is, the ends justify the means. When you say utilitarianism, it all just focuses on maximizing the good outcome. As long as the good consequence or the good outcome is maximized, whatever you did is justified. Ingon ana ang belief ni utilitarianism. Dili kay siya by the book nga mo follow og rules. Although na siya gi-follow nga rules, but dili kay siya kanang very strict on it as long lagi as maximize ang good consequences. Utilitarianism is often used in public policy development when they make the laws. Diba? When they make the laws, they always think of what will benefit most of the people. Ingon ana, unsaon pag-maximize sa good consequence. What will benefit most the majority of the people. Ingon ana. A common criticism of utilitarianism is that it de-emphasizes relationships to maximize outcomes for as many people as possible. On the other hand, deontology is the opposite of utilitarianism. It is a duty-based moral theory that is based primarily on the work of Immanuel Kant. It's a Kantian theory with moral rules are universal and never to be broken. Consequently, doing one's duty is considered primary regardless of the consequence. So kani siya, by the book ang pag-follow, bahalag dili ma-maximize ang good outcome as long as you do everything by the book step by step. So from a Kantian perspective, respect for people is a moral imperative. Therefore, withholding the truth disrespects the client's right to know. A common criticism of deontology is that it overlooks the potential for conflicting obligations, overemphasizes rules, and underemphasizes the consequence of actions. So opposite siya ni utilitarianism, which looks at the consequences, maximizing the good consequence, bahala na ang imuhang means. But deontology is very focused on overemphasizing the rules, following the rules no matter what the consequence are. Claro? Claro? Okay. So Code of Ethics, this is actually developed by IOTA. It's a set of values and principles used to promote and maintain high standards for the behavior of OTs. You will be discussing this next week. I believe so, or next week. Yes. Now let's go to difficult conversations. So how do we deal with difficult conversations? No? Again, this is applicable, may it be in your personal life or in your professional life. How do you deal with difficult conversations? Difficult conversations with your parents kung di kasabaan mo, no? Unsaon ninyo pag-deal with difficult conversations? Number 1 is to be present. Be present, not just physically, but mentally. Be present physically and mentally. Karang inyong mga naong, kay baw ko kung mentally absent mo karon. Kay baw ko anang inyong pagtanaw na ko karon, gatanaw mo sa camera, ga-smile-smile, gasanong-sanong. Right, guys? Right? Yes, guys? Galutaw ang utok, no? Klaro kaayo mo ana, guys. Maski akong bana kay baw ko ana, when I talk to him, listen to me, listen. You don't listen with your ears alone. You listen with your eyes as well. You have to look at the person and assure them that you are listening and that you are present mentally and physically, no? Inyong mga utok karon unsa ka akong kanon for lunch? Unsa kay pagkaon na mo karon? Unsa kay giandam ni mama or ni papa kay gigutom na ko? Munay na sa inyong utok, balutaw-lutaw, di mo mentally present, to? Ga-smile-smile ra ang uban. Ang uban, mura gihapon ang naong. Galutaw gihapon. Smile din sila kay wala mi naglataw miss ay utot ninyo oy. Okay. Next, aside from being present, use open-ended questions, use open-ended communication and listen quietly. When you listen, sometimes we listen, especially when you are in conflict with a person, you listen to respond. Gastorya pa gani ang tao, imong utok gadagan unsa nay itubag. 'Di ba? When especially when you are in conflict, kamong mga nayuyab diha. Gayaw-yaw pa ang usa, ang inyong utok gadagan na unsa may ako itubag niya, dili kay kani kana. Muna na you listen to listen. You listen to understand. You listen to understand. You don't listen to respond. That is a very big difference. And that is something that is very hard to do. In the clinics, it's very easy. But in my personal life, it's so hard to listen to understand. I am very guilty of that. Most of the time, I listen to respond. Ingon anak ko, gadagan akong utok. Dili lagi kay kuan lagi. Magbuot na dayon, no? Listen quietly. Remain focused on the person and the goals of intervention. You do not sway away, but you listen to the person. You focus, remain focused on the person and your goals for intervention. You have a contrite and a humble attitude, no? We do not show them that we know better because we're therapists and all. Have a contrite and humble for attitude, outlook, no? You legitimize the losses that the person is experiencing. Aside from legitimizing the losses that they feel or that they are experiencing, normalize how they feel. This is one thing that I've learned with the work that I am working in, some mental health coaching. I've had clients who've had, trauma. So it's very difficult when they talk to me about their trauma because I feel like I have the secondary trauma as well. It's not easy when someone tells you, I've been battered by my husband, he tried to choke me, he tried to like this and like that. It's not easy. I've been physically abused, someone is stalking me. Other things, aside from that, when they lose when they experience losses. Um, they share their experience that they feel sad, or they are still mourning or grieving. It's hard, but you have to legitimize their losses and at the same time normalize how they feel. I usually tell them that, it's normal. It's normal, actually, the response, how you feel. If you feel sad, if you are grieving, if you are scared, if you are, whatever you're feeling right now, it's normal. um when you normalize their feelings, Manggod, it makes them realize that, okay, this is okay. I'm not crazy. What I'm feeling is not wrong. So it assures them ba that whatever they're feeling is correct. Is normal. I'm sorry. It's normal. Ensure shared decision making, that you will not be taking hold of everything, and you make a team effort. So that is dealing with difficult conversations. So, okay, I have an example question here. I will be giving you 1 minute to read and choose your answer.